Doctors of Reddit. Have you ever seen someone outside of work and thought, wow, that person needs to go to the hospital now? What were the symptoms that made you think this? My grandfather was the definition of a walking doctor. Was not afraid to ask you about your bowel movements within the first 5 minutes of getting to know you. Sitting on a plane next to him, waiting room of the DMV, lunch. He would talk with everyone and everything if it meant he got an interesting conversation. One time he diagnosed a person he was sitting next to on a flight with von Hippel-Lindau, VHL, which is a rare disease that causes tumors to grow randomly on the body. The guy said specialists he'd been to could not figure out what caused them, and later contacted him after tests were done for the disease to tell him he was correct in his diagnosis. Have tons of other stories similar to this. Second DKA diagnosis in this thread. When I started medical school many years ago, my buddies and I, at different med schools across North America, came home after our first year and noticed our friend Dave had lost a ton of weight. For the next few days, we all made fun of him as he ate a lot, dozen donut in one sitting, and drank a lot of water. He felt crummy the next weekend. Breath was noticeably sweet, and we made the straight out of the textbook first year med student diagnosis in our heads. We hauled him to the ER where they admitted him. Diagnosed him diabetic ketoacidosis as the first presentation of type 1 diabetes mellitus, and started him on IV insulin. Dave went on to many great things. My cousin is a nurse and I wanted a second opinion on my tit. After seeing my DR the previous day, I sent a photo of my tit and my cousin replied hospital. Now, I had mastitis turn abscess from breastfeeding. It was the worst case anyone at my hospital had seen. Heck, they had doctors, nurses and students all coming in to see my tit. By the time I had surgery, this infection was protruding and filled with blood and pus. It went from red and swollen to pus and blood within 6 hours. It was huge. After surgery they stuffed my boob with 5 feet of gauze. It was removed by one nurse who had zero clue I had no painkillers in my system at the moment. I bawled and screamed in the shower as she ripped it all out. She apologized after realizing I felt every bit of that gauze coming out. Worst experience of my life hands down. I had to have a nurse come daily and change my packing and bandages for 6 weeks because the gaping hole almost made me pass out after the gauze removal. In a hoe. Thank God my cousin told me to go. The girl I was dating worked at a daycare. She had her regular parent-teacher conference one night and told me she was dreading having to tell one family that their 8-month-old was developmentally far behind compared to the other kids. He wasn't crawling yet, but was barely able to pick up his head when lying on his back. She tells me that he's still a cute kid, but has a really big head. All these are the typical signs of hydrocephalus, a condition where fluid gets trapped inside the brain. I asked her to have the parents see a neurosurgeon. The kid ended up having surgery to have a shunt placed, and has now developmentally almost caught up to his peers. Yes, I'm a doc and a few months ago my wife and I were at a restaurant and an older gentleman passed out. Fell down and hit his head on the counter. He was unconscious for probably 30 seconds. I went over and checked him out. He came to, was a little confused, and blamed it on his blood sugar, actually passing out from a blood sugar issue then bouncing right back and being awake without eating drinking would be pretty rare. I asked medical history type questions and found out he's on Coumadin, as evidenced by multiple bruises on his arms and head. He had a nice big cherry on his head and a huge bruise over his temple and told me that he passes out all the time so this wasn't a big deal. 1. With multiple syncopal, passing out episodes at his age he likely has an arrhythmia which could be dangerous and needs to be checked out. 2. He just suffered a head injury and is on blood thinners and could have a brain bleed. 3. He had a headlock that probably could have used closing. I highly advised he go get checked out at the hospital but he of course refused because, again, this happens all the time. Edit. Came to. Not came to. Sorry guys, haha. Saw a man sweating profusely, eyes popping out in the middle of winter with a light sweater on. Told him to see his GP today to get a thyroid blood test today and get referred to an endocrinologist for Graves' disease. Called me crazy and to mind my own business. Ended up seeing him in clinic next week during my endocrinology rotation. Hi doc, sorry I called you crazy. Obligatory, not a doctor, but my whole family are doctors. Seriously. Both my siblings, my mother and my father are doctors. I live abroad, but went home to visit my family over the Christmas holiday and unfortunately had to leave my husband back in the UK. I got off the plane and I felt pretty crappy, but I just chalked it up to motion sickness from the long airplane ride. However, over the next few days I just got worse and worse. I felt really nauseous and exhausted, and I had terrible pain in my stomach. This went on for about a week. My mum was the first one who called it. Told me I was definitely pregnant. I completely denied it. I had an IUD and I hadn't missed a period. So in my mind there was no way I could be pregnant. When my mum found out I had an IUD, she forced me to go to emergency immediately. Turned out to be an ectopic pregnancy. Luckily they caught it very early, so no damage to my fallopian tubes or my reproductive future. But yeah, she definitely saved me. If I had waited to go to the doctors after I had returned home, it would have been way too late. So very thankful for my genius mum. I won't be able to see her over the holidays this year. Now I really miss her. My grandfather was walking up a hill and got a bit winded. More so than usual. He's diabetic, so thought it may be related and played it off as if it was nothing. A week goes by and he's still complaining. Feels a constant pain in his chest and shortness of breath. Finally he decoded to see the doctor, who takes one look at him and tells him to go across the street to the hospital. EKG and a couple tests later, it turns out he had a heart attack and needed quadruple bypass. Were it up to him, he'd never have even gone to the doctor in the first place. I had a med student diagnose me as a teenager in a bookstore as having migraines. I was reading and all of a sudden I lost all vision in my right eye. I yelled that to my friend who was standing next to a med student who was browsing in the same section. He did the smile test to see if I was having a stroke. I wasn't. He told us to get to a hospital just in case, but warned that a horrible headache was probably going to start. Went to the ER and sure enough, as I was getting checked in, a red hot pain started behind my eyeball. Tada! Migraine. My doctorate is in astrophysics, but the guy bounced off the hood of a car, flew 20 feet, bounced his face on a manhole cover, and tumbled 20 feet down the road. I knew that guy needed to go to the hospital right away. The blood pouring out of his face was the most conspicuous symptom. Not a doctor, but I love watching House. This is important. My mom was a piano teacher and had a student who broke her femur playing soccer. Full speed collision with another girl and it just snapped. Yuck. Anyway, she was having tons of problems in the hospital. Coded twice. Respiratory issues. I remember watching an episode of House after the Super Bowl where he diagnoses the woman in Antarctica. The issue was an improperly set broken toe, which was throwing marrow into the bloodstream. I mentioned this to my mom when I heard about it. She mentioned it to the girl's mom. The mom brought it up to the doctors. Lol, no way. She coded again. So they made the doctors check. Yup, improperly set. Thanks House. Edit. Woo. New top comment. Also an actual doc. Had a janitor who I was friendly with stop by to shoot the it. Just small talk sort of stuff. He says, I've been doing great but my left leg's killing me. For whatever reason I say, is it swollen? No idea why. There are a million reasons for leg pain. It just came to me and of course it is. Right leg's normal. I think you have a DVT. You need to go get that checked. Like today. P. Being a typical male, and I can say that because I do damn it all the time too, says, no, I'll just tough it out. Long story short, had to go to his boss to get them to get him to go to the hospital. Clearly had a DVT and if I recall correctly had some small pays. Super nice guy. Did fine. Not a doctor but my daddy's. Every morning at 4:30 AM we do boxing and general fitness training. Dad was looking a little it and under the weather but insisted that he was fine and that he just didn't get enough sleep. 45 minuets in were sparing, he's starting to go pale. I point this out to him. Dad sort of just freezes and tells me to get my phone, I'll call an ambulance. He then proceeds to just drop like a sack of rocks. Turns out he had a blood clot in his carotid artery. Had to go into surgery for most of the day. Worst day of high school ever. Not knowing if he was going to make it or not. Edit. Medical it. Edit 2. This incident was a result of a mistake made during the removal of my father's pacemaker defib, had it put in him after he suffered a heart attack in his early 30s. I'm an optometrist and I can spot a child with a vision defect at 10 feet. Not all, but particularly the far-sighted, amblyopic and those with strabismus. Even a slight eye turn is so obvious to me because I look at eye alignment over and over day in day out. Pretty much the opposite to what you are asking, but my wife went over her ankle wearing heels last year. I convinced her to not go to the ED for 3 weeks before finally taking her. I was making fun of her being a hypochondriac the whole time. Turns out she had a fractured metatarsal. I am an ED doctor. We went to the department I now work at permanently. I will never live this down. Not me, but my dad, who's been an anesthetist for many years now. He used to operate before monitors were common in the less developed parts of the world, and so used to monitor a patient's heartbeat by checking the pulse on patients' wrists. Over time he developed a habit from this, and when he handshakes anyone, his 2 fingers immediately go to the person's pulse. Once he met an acquaintance in the street, sensed from the handshake that something was wrong and told him to go to the hospital ASAP because he had atrial fibrillation. I'm an ER nurse. When I first started working, I would see a patient and think, oh wow, this person really needs to go to the hospital and needs a nurse. Then I realized that's me and I panicked for a while. As a hypochondriac, this thread is a ducking nightmare. I'm out. Not a doctor, but possibly saved a life. My wife works for a charity that provides all kinds of support for children with cancer as well as their families. I learned the signs of retinoblastoma when a family moved into her work for treatment. I noticed the same signs in pictures of a co-worker's grandchild. I forced myself to make small talk and mention it. Sure enough, the child had retinoblastoma. It was found early enough that they were able to save the eye. Doctor here. My mother came home about 6 months ago and told me that a friend of the family had been having some difficulties for a week or so where he kept on bumping into things. He had shrugged this off as a virus and felt that it would clear up by itself. I asked if he was bumping into things on the same side all the time, and it turned out that he did. The left-hand side. This is a likely sign of spatial neglect or a loss of vision on one side. 2 possible manifestations of a stroke. A common cause of stroke is atrial fibrillation, essentially an irregular heartbeat where the heart turns into a fun little stroke-making machine which fires clots up into your brain to block off the circulation, which is treatable. I advised my mother that this guy go to the hospital immediately to be assessed. He had the rhythm as suspected and they shocked his heart back to normal rhythm. He was at high risk for developing further strokes and I believe he's doing quite well now. Not a doctor, but that happened to my sister. She went to the doctor because her breathing was a bit weird and she had been feeling awful for a few weeks. Straight to hospital in an ambulance. Turns out she was a diabetic, type 1, and was very close to being in a coma. Oops. I had a friend call me to ask my advice. A mutual friend of ours was pregnant and at 35 weeks. They were all out to dinner and about to go see a movie when this mutual friend had mentioned she hadn't felt the baby move in about 10 hours. So my friend called to ask if they should call her doctor. I'm not a doctor, just someone who has been pregnant before. But even I knew that was bad news bears. I told them to forego calling the doctor, just go to land to get monitored ASAP. They got her there and they found the baby very low amniotic fluid and the blood oxygen levels were so low that the doctors were surprised the baby was still alive. Emergency C-section and baby and mom were fine. Still scares me to think that if they hadn't called or she never spoke up, what could have happened.